If you've got back pain, your doctor or physiotherapist might have suggested you try something called a TENS machine. But how does it help manage your pain, and is it suitable for you? In this video, I'll answer all of this, but first a little bit of background on what a TENS machine is. Well, transcutaneous electrical nerve stimulation, which is a bit of a mouthful, or TENS, uses low voltage electrical currents to relieve pain. Now, a TENS unit is a small device that delivers these currents at or near your nerves to block or change your perception of pain. Now, healthcare providers often use TENS to treat a range of conditions including osteoarthritis, tendinitis, and fibromyalgia. TENS therapy tends to work well for many people. However, researchers agree that it works better for some than others. Now, the specific way in which it works to help to reduce pain is thought to be from two things. One is that the electrical current stimulates nerve cells that block the transmission of pain signals, changing the way that you perceive pain. The other is that the electrical current raises your level of endorphins, which are your body's natural pain-killing chemicals, which then trigger your body's own ability to relieve pain. Now, in terms of what it's used to treat, well, TENS therapy is used to treat a range of acute, so short-term, as well as chronic, meaning long-term conditions, including back pain, osteoarthritis, fibromyalgia, tendinitis, chronic pelvic pain, as well as diabetes-related neuropathy and peripheral arterial disease. So what does it look like? Well, a TENS unit is a battery-powered device that is about the size of a phone, with electrodes that deliver electrical impulses through the surface of your skin. Now, a healthcare provider typically places the electrodes at or near trigger points or affected nerves. Now, the TENS unit then delivers pulses of electrical energy. Now, you can adjust the intensity, frequency, and duration of the pulses until the electrical impulses feel strong but comfortable. Now, TENS therapy usually helps ease pain during treatment, but the level of pain relief following the session will vary from person to person. Some people feel better for up to 24 hours after the session, whilst others say that their pain returns as soon as they switch off the TENS unit. Now, generally you can use a TENS unit as often as you want. Some people use it several times a day for up to 60 minutes each time. However, it's best to check with your health provider before starting. Now, in terms of where to get a TENS unit from, well, many healthcare providers offer TENS therapy in office or hospital settings, but they can also prescribe a TENS unit for you to use at home. Now, additionally, you can purchase an over-the-counter TENS unit at your local pharmacy or Amazon without a prescription. Now, regardless of the type of TENS unit that you choose, it's a really good idea to talk to your healthcare provider, such as a physiotherapist, first. Your provider can also give you guidance on how, as well as where, to apply the electrodes or the sticky pads that are going to sit on your back. Now, whilst a TENS unit might sound wonderful, they are not suitable for everyone. Now, you shouldn't use one if you're pregnant or if you have an implantable device like a pacemaker, which will sit here in your heart, cancer, epilepsy, a deep vein thrombosis, also known as a DVT, bleeding disorders, or heart disease. You also shouldn't use TENS on or near infected tissues, damaged skin, varicose veins, the eyes, the head, the genitals, as well as areas of numbness or areas that have recently received radiation therapy. And again, I would always check with my own health provider before using TENS, especially if I had an existing health condition. Now, in terms of benefits and risks, TENS is a non-invasive procedure, and you can use it alone or in addition to pain relievers. It may also help reduce medication doses in some people, though you should always talk to your health provider before changing your medications. TENS units are small and portable, and the method effectively relieves pain for many people. However, possible side effects include allergic reactions to the sticky pads, uncomfortable sensations, sometimes described as a prickling or tingling feeling, and very rarely burns from the electrodes, which is why it's really important that if you're going to buy a TENS machine over the counter or on the internet, that you purchase a reputable machine. Now, to help you do this, look for FDA approval if you're in the USA or CE marking if you're in Europe, indicating that it meets safety standards. Additionally, try check for compliance with ISO 13485, which is a standard for medical device quality management systems. Finally, a really common question is, does TENS really work for pain management? Well, more research is needed to fully understand TENS and to find out exactly how it works. Some studies show that TENS relieves pain in many people, whilst others suggest that a placebo, which is a treatment that appears real but isn't, works just as well. Success likely depends on several factors, including the underlying condition that's being treated, electrode placement, and TENS unit settings. In most cases, using a TENS unit shouldn't cause any serious health issues, but it's important to check with your health provider before trying it. If you found that it works for you, please do let me know in the comments section, and please do share your own experiences which might help others.